social health initiative that is set to impact the lives of many Bhutanese. A nationwide non-communicable disease NCD screening is going to be commenced on 14th of November, that is tomorrow, also coinciding with the World Diabetes Day. And to know more about this nationwide screening, we are joined by two esteemed guests. First, we have Dr. Dakal, who is a medical specialist and who is heading the NCD unit. And next, we have Mr. Karchung, who is a chief program officer of the NCD unit. So, welcome both of you.
Thank you.
So,
Thank you very much.
Begin with, I'll go with Dr. Dakal first. So what is the main objective or purpose of this nationwide NCD screening?
Okay. Few things that are very characteristic of the non-communicable diseases is these diseases are not symptomatic.
Yes.
Even if you have high blood pressure or high blood sugar, the patient will not have symptoms and signs. So people will feel that I do not have the disease, so they wait till the symptoms appear. And by then when the symptoms appear and then they come to the hospital, a significant amount of organ damages like damage to the kidney and eye and the heart would have occurred. So our main objective actually is to screen those people who already have the disease but have not developed the symptoms, who have not come to the hospital but they are harboring the disease. The other reason of screening is another good characteristic of these non-communicable diseases, especially diabetes and hypertension, is that if you have the risk factors,
Yes.
and if you take care of these risk factors, we can prevent them from developing these diabetes and hypertension. So we'll also be screening those people who have higher risk of developing hypertension and diabetes. So our main objective is actually to reach to those people who do not have symptoms but yet have the disease and have not put in treatment. And the second objective is look at the risk factors.
Yes.
And those people who have the risk factors to develop the disease, we want to start them giving the health education on how to prevent from getting these diseases by addressing the risk factors.
Yes. Thank you, Doctor. So to Mr. Karchung, what kind of screenings will be done in this nationwide screening?
Good evening to all viewers.
Yes.
I, on behalf of the Ministry of Health, would like to thank BBS Tungsu program for letting us to disseminate information on ongoing plan of the nationwide screening program, which is scheduled to happen from the 14th November till the 7th December,
Yes.
coinciding with the World Diabetes Day tomorrow.
Yes.
The 4 parameters which we really have identified, this was identified because of really with the reason that according to the National Health Survey data what we have, that was revealed in 2023 of the data, 62% of our adult population who has high blood pressure are not aware that they have the high blood pressure. Similarly, with the adult population of 18 years and above who had diabetes, 60% of the population, they were not aware, saying that they have a high blood sugar level. So, and also on the other matter that what we have right now, I think almost 70% of the mortality in our country are due to the NCD, non-communicable disease. So given with this reason, so we have identified in the 4 parameters that will be screened for 18 years and above. So we'll be checking height and weight, that's called the body mass index,
Yes.
BMI, and then also we'll be checking for the blood pressure. And next category that what we have identified is for 40 years and above. We'll be taking up the all 4 parameters,
Yes.
height and weight, which called BMI, check for the blood pressure, we also check for the blood sugar, and the 4th parameter that what we have identified is to assess for the CVD, cardiovascular disease, so that which we will have to identify the risks of developing the cardiovascular disease within 10 years. So these are the 4 parameters that what we have identified for the upcoming nationwide screening programs.
Yes. Why not inclusion or screening for the sugar and cardiovascular disease done for the above 18 ages? Is there a specific reason for that?
The very reason the why we have kept the age for the 40 years and above for the checking up of the blood sugar and the cardiovascular disease risk assessment, the risks for developing of the diabetes and also the risks of developing the cardiovascular disease. The age, it says that if the adult age of the 40 years and above, they have the more risks of developing the cardiovascular disease and other NCDs. So that's the reason why which we have identified for those age category that which we will be taking up.
Just to supplement him, because the common type of diabetes that we get in Bhutan is type 2 diabetes. The type 1 diabetes, which starts at younger age, is very uncommon in Bhutan. So since the type 2 diabetes occurs in people more than 40 years of age, more common after 40 years of age, ideally if we had the resources, maybe we could have start screening from 18 years, but it's very, very uncommon to develop type 2 diabetes before the age of 30 or 40. So we took 40 years because type 2 diabetes, which is very common in Bhutan, is more common after the age of 40 years.
Yes. Since it is mentioned that the screening parameters are BMI, blood sugar, BP, and the risk factors for cardiovascular diseases.
Right.
So since the name non-communicable disease screening, why not the inclusion of screening for other non-communicable diseases like dental problems, then not stroke, some like precancerous symptoms. Why not test those other non-communicable forms of diseases?
Yeah, I think that's a very good question. Ideally, if we had the resources, we should be screening for all non-communicable diseases. But the scenario in Bhutan, as Mr. Karchung was telling, of the 70% of the deaths that occur due to non-communicable diseases, almost 23%, about 23% is because of the cardiovascular diseases, which includes the stroke and the heart attacks. Now, what are the risk factors for these stroke and heart attacks? Are the diabetes and hypertension. So if we screen diabetes and hypertension, and if you address these problems, if we prevent people from developing diabetes and hypertension from now on, a significant amount of deaths actually can be prevented. And the quality of life also of these people who do not develop the disease is also going to improve. The main reason is that because of the 70% death, 20% of the deaths are from the cardiovascular diseases. And since diabetes and hypertension are the 2 main risk factors for developing these cardiovascular diseases, we want to address them first. Once we address them, definitely we'll have to address other non-communicable diseases. In fact, we have already screened for gastric cancer last year, a couple of years back. We also screened, and these programs are actually already going on. We are already done screening for cervical cancer, we have already done screening for breast cancers, and these programs are already ongoing. We did in a flagship mode a couple of years back, and they are already going in the health centers. Now we need to focus on the diabetes and hypertension to prevent deaths from the stroke and heart attacks. That's the main reason.
That's to Mr. Karchunga. So where does this screening happen in the district levels? Is it in the primary healthcare centers or the nearest hospitals, or are there separate camps or posts designed for the screening?
Well, in regards to the screening places that what we have right now, so that in terms of the screening post, that which we have already discussed with our colleagues working in the district, with the district public health officer and the medical officer in the districts. So in the country of 20 districts, which we have more than 250 health centers across the country. So all the screenings that what we have planned will happen in the respective health center, in hospitals.
Yes.
Also, in terms of the community where we have primary healthcare centers in the GEOC level. So furthermore, again, we also have outreach clinic settings, which we have more than 550 outreach clinic structure in the country. So beside this, again, there are places where there are community where they stay in a far-flung. So for this community as well, our colleagues from the district public officer, medical officer, and our other health category of the health worker, they have strategically planned to reach even the underserved area. So in a total of more than 1,500 places have been identified to undergo screening as a nationwide for a period of 3 weeks.
So when can individuals visit the hospitals? When does the screening start? Is there a specific time?
Well, when we had a discussions with our colleagues in the districts, we have agreed and planned that for a period of first week,
Yes.
all the screening will take place at the district and at the community level.
Yes.
So upon the completion at the respective districts, then the team from the respective hospitals or the team which are established at the primary health centers, they will move towards the GEO, and then furthermore at the end stage, upon the completion at their respective centers, again they have planned to move further to the communities. So in a stretch of 3 weeks period, starting from tomorrow till the 7th December, so we have actually planned to complete within a 3 weeks of period, Junila.
But is there exact time where you can invite people for the screening, like 9 a.m. onwards, or maybe like 10 a.m. onwards?
Yes. So yes, I think this is really an important question that I think we really need to inform our people when they need to come for the screening. So when we say for the screening timing, well, when we have this checkup for the blood sugar, that what we have identified for the age 40 years and above, for this, I think the people who are eligible for the screening for the raised blood sugar, I think they really need to come with the fasting.
Yes.
Which when we say the fasting, I think it's minimum of 8 hours that people need to come for the screening. But we also have discussed that the screening will happen from 9 a.m. till 4, or even if there are crowds in a specific area, that may extend till 5 p.m. But the program do not end on this day, but that the program will keep on continuing in the different locations. But
Yes.
Whatever the information that I think we really need to give a proper information to the public on the specific date. For just to give an information with regards to the Thimphu, for Thimphu tomorrow on a first day of the launch coinciding with the World Diabetes Day, we have planned to screening at Thimphu Tashchozong for the monastic body. So on the following day, from the 15th till the 21st, with the support from the Royal Civil Service Commission, so RCC officials, they are leading us for the screening for the civil servants in Thimphu.
Yes.
From 15th till the 21st of the November, for a period of almost 5 days, we have identified any 3 locations in Thimphu to screen for civil servant. So upon completion with the civil servants in the 3 locations, then we also have the other number of days, almost 14 days, that will be stretched over from Dechiling and from the Semtoka, and then we also have another group to cover in the middle of the core town. So in that way, so within the 3 weeks of the period which we have planned to complete in Thimphu. Similarly, when we have a plan in Thimphu with this strategic planning to cover for the whole population, so what we hope that for the districts with the small population and the catchment, I think they can do it proper, Sejunila.
Yes. So, doctor, it is said that the population age above 18 are eligible for the screening.
Yes.
So what about individuals that have already been diagnosed with some sort of disease or NCD cases, and they're already going through treatment? Are they also invited for the screening?
That's a wonderful question. Actually, we should have cleared this little before.
Yes.
Those people who are already diagnosed with high blood pressure, hypertension, and on medication,
Yes.
and those people who are already diagnosed with diabetes and hypertension need not come for screening because they are already diagnosed.
Yes.
The word screening itself means those people who have not been diagnosed previously.
Yes.
And it also actually includes, we have actually already talked with district public health officers that elderly who have already screened, actually we had a screening program for elderlies who are more than 65 recently, they also need not come, right, Ms. Karcham? Yeah.
Yes.
So basically those people who have already been diagnosed on and medication for both diabetes and hypertension need not come, and those elderlies who have already been screened and then within the month of September, I suppose, or that elderly month, also need not come for the screening this time.
Yes. So, doctor, besides what Mr. Karchung mentioned about the fasting thing, is there any other advices, do's and don'ts for individuals to consider before coming to screening?
The first is, of course, those who are 40 years of age and above and who are supposed to be screened for diabetes, they need to come fasting.
Yes.
For fasting, as Mr. Karchung already said, is no calorie intake for 8 to 10 hours. That's the gap during which we'll be taking the blood sugar. Fasting doesn't mean you should not drink water. You can drink water, but not tea or juice or anything like that, because that contain calories. So water doesn't contain any calories. So you can drink water and come. If you are taking some medicines, you can take those medicines other than for of course not for hypertension, diabetes, because you are not coming for that, but for other diseases, if you are taking medicine, you can take that. And those people who want to measure blood pressure, actually we have strict criteria where you shouldn't be taking tea and coffee for half an hour, should not be, you will be taking rest for about 10 to 15 minutes. So those criteria are already there. Other than that, I mean, we don't have any other strict criteria that these are the strict criteria that the screening has it. Yes, Ms. Karchung, do you have anything?
So, Mr. Karchung, anything that people should bring for the screening? Maybe like ID or any other pre-history, like medication history or their health record or something like that.
Well, just to inform to all our viewers, so in terms of the screening, that the recording system that what we have just a simple in a Excel sheet that what all the patient's detailed informations will be entered in this, and the parameters that what we have informed out here, this all will be recorded in an Excel sheet for the proper recording and the follow-up care. So when they come for the screening, we just have the simple recording that what we just really like to know is the CID number that will be recorded in order to put up into a follow-up care. That's all that I think. Other than that, I think we don't have the other thing that need to be bought when they come for the screenings.
Yes. Yes, doctor, after the screening, what's next?
Again, this screening actually is a little bit different from what the previous screening programs were. Now, let's be very clear. Screening doesn't mean diagnosis. Okay, screening means you have the risk factors of developing something like that. So if I go to the screening center and I do my blood test and I find that this blood test is above the cutoff value and I may have diabetes, all these people who have these will be called to or will be directed to the health center, whether it be it a hospital or local primary health center, where again we are going to do some more tests to confirm that whether this gentleman or the lady has diabetes or not. So after screening, we will, if we find that this person has high risk of diabetes, we will confirm the disease by the test, further test. Same for the hypertension also, high blood pressure also. We'll check the blood pressure. We find that it is at above the cutoff value. We'll again recheck to confirm that he or she definitely has blood pressure before we start the medicine. And also those people who already have high blood pressure will screen further to find out if they have any metabolic abnormalities, like do they have high cholesterol, does this person who has high blood pressure also has diabetes. But this we are going to do at a health center, because it will be logistically not possible to do all the tests at the same time. So also those people who have higher risk factors, like when we measure this BMI, body mass index, by height and weight, these persons, those who have higher risk of developing diabetes, we will be giving health education and brief interventions how to tackle these risk factors not to develop diabetes or hypertension in future. So it's not just screening. We will also be confirming the diagnosis if somebody is suspected to have it. And we'll also address the risk factors at the same time. The other important thing which actually Mr. Karchung would have forgotten to say is we want their mobile number, because we want to follow them actively. That somebody who has had raised blood sugar, if he hasn't come to the health center for confirming the diagnosis, we want to proactively follow up and remind him or her that you need to come for blood sugar to confirm the diagnosis, and then if need be, you need to start the treatment. So this screening program, Mr. Karchung will definitely agree with me, is little different from other screening programs where we just screened and left the people. But this screening program will definitely link this person who has these problems into care, and then follow them proactively so that we can either prevent or treat it on time.
So, Mr. Karchung, this is a great initiative started off this year. So, is there plans to continue nationwide screening campaign the year after, hereafter?
Well, given the burden of the NCD and the situation in the country, so it's definitely that the screening is going to happen. So whatever we have been doing right now, I think in terms of the screening, that what we have planned, so we will be having a proper data in terms of the disease that what we have in right now. So with the screening, we will probably have a good information system for the respective districts. So hereafter, the districts will have their annual plan for the NCD screening, and then they would be able to put into a proper interventions with the burden that what they will be having in their respective districts.
Yes. Yes, Doctor, with the discussion on the screening, nationwide screening, I also think that our audience needs to know what are some of the complications of NCDs like high blood pressure, hypertension, and diabetes.
Thank you, because as I said, the diabetes and hypertension are the two main risk factors for developing the cardiovascular diseases, right? And also the kidney failure, renal failure. So if we don't treat diabetes or hypertension on time, people have very high risk of developing heart attack and die. They have very high risk of developing the stroke. Stroke means the bleeding inside the brain, or there is not enough blood supply into the brain, and they either get paralyzed and have a very difficult life after that, or if the stroke is massive or very severe, we might lose life. So screening these diseases and preventing, either treating them on time, or those who have the risk factors to develop these diseases, if we can address on time, they will not progress to develop these diseases. So that's one reason why we really want to screen hypertension and diabetes. And as Mr. Karchung was telling, the 60% of the people during the survey who had high blood pressure actually didn't know they are hypertensive. And also almost 62% didn't know about hypertension, and I think 60% didn't know they are diabetic. So this survey actually is very, very useful for those people who actually think that they don't have the disease because they don't have the symptoms.
True.
It could be one of us, or no symptoms, I have no high blood pressure. That's what is the answer these days. Do I have high blood pressure? No, because no, I have no symptoms. So that's actually wrong. And once the complication develops, it's little late to treat them, you know. Of course, we can treat them, but the quality of life is not very going to be good. So yeah, the risk factors of having high blood pressure and diabetes, as you asked me,
Yes.
is the risk of developing heart attack, risk of developing strokes, and risk of developing kidney failure. Many people are on dialysis
Yes.
now. The reason is because we didn't treat their blood pressure and diabetes on time. We
Yes.
could have saved their kidneys.
Yes, doctor.
And their quality of life of a person, if you cannot go transplant, during dialysis, the quality of life is very, very poor.
Yes.
We can see that. And even to undergo a transplant, it entails a huge cost to the government
Yes.
and to the family. So we can prevent actually all this
Yes.
if we can screen and treat diabetes and hypertension on time.
Yes, thank you so much,
Yes.
doctor. So finally, since we're running out of time, I'll give you a minute or two to have the last remarks or maybe advice to our viewers about this nationwide screening.
Well, the Ministry of Health have planned this nationwide screening program
Yes.
with the main objectives for the early detection, and then through the detection, then we would able to put on the treatment protocol and then prevent the complications of the NCDs.
Yes.
And also with the screening program that what you have scheduled,
Yes.
we're also going to enhance in terms of the awareness program on the risk factors and the NCDs to
Yes.
the general population in the country.
Yes. Thank you so much, doctor, and Mr. Karchung, for your time. And today we have heard from the expert about the upcoming nationwide NCD screening. So I think it's a great opportunity to take control of your health, and so don't miss the chance and get yourself screened. And let's work together to build a healthier, happier Bhutan. And thank you so much for tuning in. As always, we look forward to having you tune in for the future episodes of Dunso BBS. Until next time, take care and goodbye.